So the first and biggest thing that I hear is people being afraid about the speed at which the vaccines were developed. Once we kind of think about, we understand what they are, I hear people say, God, Megan, Dr. Ranney, these were developed so quickly. How can I trust them? So first thing to know here is that they actually weren't developed all that quickly. The mRNA technology is well over a decade old, and there have actually been other vaccines developed with this specific technology, which got very, very close to getting approval, but never kind of made it over the threshold because of either lack of money or because the disease that they fought against was not common. So mRNA vaccines were created for Ebola, for the initial SARS virus, as well as for a number of other things. But in general, nobody funds vaccine research. It's not a part of the pharmaceutical industry normally that makes a lot of money. So nobody wants to spend big dollars on it. And it takes money to create these things and to do the trials. What was different about COVID and why we got these vaccines relatively quickly was because there was a large amount of money put in. The Trump administration put literally billions of dollars into getting us a vaccine, right? Which allowed the technology to go from these preliminary proof of concept vaccines to what we have today. And there were lots of people with COVID, which meant that we could enroll adequate number of people into these studies very, very quickly and get the results that we were looking for. The vaccine trials skipped no steps. They went from the normal phase 1 to phase 2 to phase 3. They were just able to do that sequence of steps a little more quickly than usual because of that combination of lots of money from the Trump administration and lots of people who were getting sick. You need lots of people, unfortunately, getting sick to show that the vaccines work. So hopefully that answers questions about speed.